As former Governor Mike Sullivan so aptly put it, Wyoming is a small town with long streets. Now that's a figure of speech, of course, but when it comes to healthcare in the state, it's a reality that many folks in Wyoming face. After all, a trip to the doctor isn't so simple as a quick drive down the street for the thousands of Wyomingites who live in rural parts of the state. And with 19 counties receiving federal designation as primary care health professional shortage areas, it's a challenge that impacts both doctor and patient alike in the Cowboy State.
The distances between hospitals are large, so as a trauma surgeon, I would have people flown in by a life flight helicopter for me to take care of over the years.
The distances, could be in upwards of over an hour on uninhabited roads or through mountainous areas. Winter weather conditions make that very, very difficult because of dangerous road conditions. And so sometimes, residents might not access care at all.
One such physician servicing a rural area in Wyoming is Dr. Doug Parks. He practices in Pine Bluffs at the Tri-County Medical Center, servicing citizens not just from eastern Laramie County, but from Kimball County in Nebraska and Weld County in Colorado as well. It's a wide-spanning population base that requires an equally wide breadth of medical knowledge and capabilities.
From athletic physicals to setting fractures to doing laceration repairs to doing skin biopsies and things like that, and just literally everything in it all is very possible to happen at the same day, one just right after the other.
Versatility is a necessary part of a doctor's job in Wyoming because for much of the state's rural population, there aren't a whole lot of options. Again, much of the state falls under health professional shortage area designation, although, as Keri Wagner of the Office of Rural Health noted, it's in some ways a matter of misdistribution. The state has more than enough primary care physicians to meet the needs of the population, but also has 8 counties with a combined shortage in excess of 21 full-time physicians.
Currently, Sweetwater County is the #1 neediest county in the state for primary care, followed actually by Natrona County.
Not having a healthcare option nearby can be straining. That was the case in Baggs, where the 2012 closure of the local healthcare center left residents with a 40-minute drive to Craig, Colorado for the nearest medical attention until a new clinic recently opened. And even when there are local options available, it's difficult to provide a complete breadth of services.
People that have special needs, for example, paraplegics, spine-injured people, brain-injured people, there's just not as many resources available in the rural communities. Again, people look out after each other, but sometimes you need specialized treatments and specialized care that's just not available.
Doctors also feel the strain. Burnout can be a difficult obstacle, and some doctors have struggled with issues such as low reimbursement rates, high malpractice insurance premiums, and the general isolation of the job. It's the type of calling that Wyoming hopes future doctors will undertake, and there are a number of programs in place to attract doctors to such communities. The state offers several loan reimbursement and grant recruitment programs, while medical students enrolled in the WWAMI program through the University of Wyoming and University of Washington receive significant financial aid through the state if they return to practice medicine in Wyoming for at least 3 years.
The people of Wyoming invest in their medical education through our tax dollars with the hope that then they not just pay it back over several years, but then make it a whole life choice.
The integration of telehealth also could be important to the future of medicine in isolated communities, and its impact has already been felt in some rural parts of Wyoming.
A small community in northwest Sweetwater County called Farson, they have their own telehealth clinic set up, no other providers in the community at all, and that provides basic care.
I don't see that there is any limit on what can be done by telemedicine. The barriers are legal and licensure and people being comfortable with talking on a two-way video.
Parks operates in a unique situation. He practices 3 days a week in Pine Bluffs and teaches through the University of Wyoming residency program in Cheyenne the other 2. The camaraderie and connection he finds with the rural community he cares for, however, is what he loves most about the job.
I think that there's other secondary things that are just way more valuable than the paycheck in terms of the difference you can make in people's lives and the being part of the community, and the people you care for also care about you and take care of you too, and that's a thing that you don't get necessarily in the larger practices in larger city.